We have our second expert, and I'm really looking forward to this, and as I was to Michael Tanner's presentation, because we do not have a free market system in healthcare, and I don't think we're moving towards one. Because I think, as Michael Tanner has made clear, both nominees are in some ways increasing the number of mandates and restrictions, rules and regulations on healthcare delivery. In that environment, I think sensible people are going to have to look at ways in which, from the bottom up, we deal with this problem in an environment that might be hostile to some of what people are trying to do with healthcare reform. And that's happening, because even in an environment where policy is moving in the wrong direction, that doesn't mean that intelligent and diligent people can't find ways to survive and even prosper in that environment, to work around the regulations until we move in a more sensible direction. And Greg Scandlen is going to talk about how that's already happening. He's with the Heartland Institute, is also the founder of Consumers for Healthcare Choices, and works in this area. And he is going to talk to us about ways in which the healthcare reform revolution is already occurring, not from the top down, mandates from Washington, but from the bottom up, where physicians and patients together are solving this problem and developing new ways to deliver health care. So without further ado, I'll ask you to welcome Greg Scandlen from the Heartland Institute. Greg?
Well, thank you. It's very good to be here in Pittsburgh and Duquesne University. This is quite the facility here. I'm very impressed. And it's always a pleasure to be with SEPP. The first time I got together with SEPP was in 1994, 14 years ago. And it is good to see that the organization is still thriving and growing and fighting the good fight. Just a quick comment on the who owns your body question. I deal a lot with employers every day, and more employers are saying that since they are paying for your health care bills, they get to tell you how to behave. And in fact, they will actually fire smokers, and not just smokers, but if there is a person at home who smokes, a spouse or a dependent, they'll fire the worker for having a spouse or dependent who smokes, polluting the worker's lungs, because the rationale is the employer figures, well, I'm paying for your health care tab, so therefore I get to tell you what to do. And they're looking for ways now to extend that to obesity, diet, exercise. You know, if you don't do what the boss tells you to do in these matters, they get to fire you. And just imagine, if you would, if the government were paying your health care bills, they would put themselves in those shoes. And this kind of raises the essential point that I want to share with you tonight, which is that employers are not paying your health care bills, and the government's not paying your health care bills. You are paying your health care bills. Every single penny that is spent on health care comes from us, the consumer. We may pay it out in the form of insurance premiums, in taxes, or in foregone wages when the employer provides it, but it all is our money, and it is all intended to be used for our healthcare needs. Every penny is ours, it's our money, it's our health. We should be in control of it. And that is what consumer-driven healthcare is all about. Now, let me explain to you, before I get into the details, what consumer-driven healthcare is about. Let me set the stage for why it's needed. My background was primarily with the Blue Cross Blue Shield Association. I got hired by them in 1979. In 1991, I left after this big internal dispute that we were having, this argument about what is the added value that we, the Blue Cross Blue Shield plans, bring to healthcare. And I argued as strenuously as I could that the value that we should be providing is support for the patient. That I thought we were, back then, in a unique position to help the patient navigate a complex healthcare system. And I kind of lost that argument to the folks that said, well, yeah, that's all very well and good, but it's the employer that pays, that signs our checks, so the hell with the patient. We're just going to focus on the employer. And that was the impetus that led the Blues and a lot of other companies into their misadventure with managed care, which I think was a total disaster. And in fact, whatever credibility health insurance companies had with the public was squandered by their misadventure, their detour into managed care. Now, the Blues created the concept of third-party payment way back in the 1930s. And I want you to understand that third-party payment is different than insurance. Third-party payment, as the name implies, is a triangular relationship. There's a consumer down here who pays a premium to the insurance company, or more often even, the consumer's employer is paying the premium to the insurance company, who pays a doctor to deliver a service to the patient. It's called service benefits in Blue Cross terminology. There's a triangular relationship. And like most triangles in human affairs, it doesn't work very well. There's always one leg of the triangle that feels left out of the deal. They don't know what the other two people are doing. So if you're a patient, a consumer, and you don't know what the relationship is between your insurance company and the doctor. And when you're sitting in the examining room half naked and the doctor comes in with a clipboard in hand, you don't know who he's working for. I mean, you're the patient, but it's the insurance company that's paying him. Who is he accountable to? Who is he working for? That you have to ask that question is a problem in itself.